Welcome to your total hip replacement. This video is not attempting to be comprehensive or accurate. Use it to help your understanding but defer to your doctor for questions. A total hip replacement is routine, takes about an hour, and is performed frequently. Even though patients are generally very happy, this is a major surgery with significant potential risk. Most patients receive a spinal anesthetic. A spinal may have the least impact on your heart or lungs and decreases the risks of infection and complications. Your anesthesiologist will provide more information the day of surgery, but if you are concerned about being awake, a twilight anesthesia using propofol is often given. Several hip surgical approaches are available: posterior, anterior, or lateral. They have similar outcomes, with different risks and benefits to each. A small incision is made near the hip joint. The damaged portions of the hip, including the worn-out cartilage and bone, are then removed. A metal stem is inserted into the thigh bone or femur, and a new ball and socket are placed to recreate the hip joint and allow smooth motion. Like all surgeries, this procedure carries significant risks or even death, though uncommon. It's important to be aware of them so you can make informed decisions and understand what to expect. Up to 30% of patients experience leg length differences. Most of differences are minor, but even up to 1 inch will usually adjust and will be tolerated, sometimes with a shoe lift. It takes 6 to 12 months for your hip to settle in and your muscles to balance. Dislocation is a concern, particularly within the first weeks while the soft tissues are healing. Strengthening your pelvic and gluteal muscles will decrease this risk. Infection occurs in about 0.3 to 0.5% of cases. Infections can be serious and may require further surgery, removal of the hip implant, or even loss of the hip joint. There is a small chance of nerve injury, which could result in temporary or permanent weakness, foot drop, or numbness. Deep bleeding inside your pelvis can happen, with dire consequences. Bleeding, blood clots, stroke, and cardiovascular or heart-related events may occur, but are generally rare. Buttock and thigh swelling is common. Compression shorts and stockings help with swelling and risk of DVT. When we place the implants, there is a risk of bone fracture. If identified during surgery, it will be fixed. Sometimes, we have to go back and address it later. Working on your bone health and taking protein supplements and vitamin D can help. Implant wear or loosening can occur over time, potentially requiring revision surgery. Nevertheless, newer studies show implant survival of over 90% at up to 35 years. Even though this all sounds scary, the majority of patients are very happy with their hip replacement. We'll take precautions to minimize complications, and we will do our best to address them. Some pain, hip bursitis or tendinitis, and other symptoms are likely to be experienced even with best outcomes. Exercise and stretching will improve your results. After surgery, most patients go home the same day. Our focus is on getting you moving as soon as possible, typically within a few hours. This early movement helps prevent complications and aids in your recovery. You'll likely use a walker or crutches for the first couple of weeks, then transition to a cane as you regain strength. Most patients shower right away as your dressing should be waterproof. Be careful to not fall. Physical therapy or exercise is a key to your recovery. It starts at home 2 to 3 times a week right after discharge. As you recover and regain mobility, you'll transition to outpatient therapy or a personal exercise routine. Hip precautions help avoid positions where your hip can pop out for the first 6-12 weeks. That may include deep squatting and twisting, pivoting, or extreme ranging. Most patients are able to drive about 2 to 3 weeks after surgery. We recommend trying in a safe environment, like a parking lot, with a family member supervising. We recommend joining a gym for long-term recovery. Access to a stationary bike, which can be used 3 to 5 days a week for 30 minutes or more, and weight training will help strengthen your muscles and improve flexibility. You may receive opioid pain medication after surgery. Keep in mind, they can be addictive and bear significant risk. So wean off as early as possible. To educate and alleviate concerns, research strategies for pain control and opioid-free recovery. Tylenol and ibuprofen may be all that you need. For medication refills, call ahead and only during regular office hours. As for returning to your usual activities, Desk workers return to work around 3 to 4 weeks after surgery, while more physically demanding jobs, such as plumbing or carpentry, may take 2 to 3 months. You can swim at 3 weeks. Golfers can expect to be back on the green at around 4 weeks. Skiing, tennis, and other high-demand sports may take 3 to 4 months, although some patients return even earlier. Everyone's recovery is personal and varies based on individual factors, but motivation and early return to activity are critical to achieving the best outcome. If you have any further questions or concerns, always feel free to reach out. We're here to support you throughout your journey to recovery, and we look forward to helping you get back to your best self.